Hi, my disease presentation is over MRSA. MRSA is methicillin-resistant Staphylococcus aureus. It is an infection caused by a strand of staph bacteria. MRSA also is known as the superbug because it is resistant to most antibiotics. In fact, most people die from MRSA than from HIV in the United States. Many credit the overuse of antibiotics as the main cause of increase in resistance to antibiotics. Some signs and symptoms. Some people think it's a spider bite. Another first sign would be a raised bump or boil. It's tender to touch, red, painful, and you might see some pulse coming out of. And it first enters the body through openings of the skin, such as cuts or openings from an IV. Most MRSA infections occur in people who have been in the hospital or other healthcare settings such as nursing homes or dialysis centers. This type of MRSA is called healthcare acquired because it's people in the hospital get it due to weaker immune system. And another type of MRSA is called community acquired, and it is spread by skin-to-skin contact. At-risk populations include groups such as high school athletes, child care workers, people who live in crowded conditions such as prisons. They have a higher number of MRSA. Skin-to-skin contact, having open skin, and a low immune system are some causes of MRSA. The microbe description of the MRSA bacteria are spherical gram-positive bacteria, which are immobile and form grape-like clusters. They form bunches because they divide into planes as opposed to their close relatives, Streptococca, which forms chains because they divide only in one plane. They're facilitative anaerobes, which means they grow by aerobic respiration or fermentation that divides lactic acid. So, Staphylococcus aureus is a gram-positive bacteria, which means that the cell wall of the bacteria consists of a very thick peptidoglycan layer. They form spherical colonies and clusters in two planes, and they have no flagella. Some of the treatments for MRSA would be applying warm soaps to drain the pulse inside the boil, that needs to be followed by an antibiotic intervention. The majority of serious MRSA infections are treated with 2 or more antibiotics, such as vancomycin, Bactrim, or Septrim. Don't stop these antibiotics early. Take the full amount of antibiotics. so you won't get it again. Draining and surgically incision of the boils are extremely painful. So go to your healthcare provider when you see the first signs and symptoms, so they can run lab tests to see if the patient have MRSA, and if they have an infection on the skin, the doctor will culture the infected area. It depends on the symptoms. The doctor might test the blood, urine, or sputum. Some precautions to take are to keep cuts and scrapes clean and covered, avoid contact with the wounds of others, avoid shaving, avoid sharing personal items such as towels or razors, and avoid any surface that may be contaminated by bodily fluids. If not treated, MRSA can enter the bloodstream, which causes sepsis and could lead to death if not treated. Notify your physician if the condition does not improve within a few days after antibiotics. Unfortunately, people can die from MRSA. So you need to take the appropriate antibiotic therapy and use all the precautions that I just told you about. Washing your hands is very important. Early treatment and taking all of your antibiotics, good hygiene, prevents the spread of MRSA. And that's it. Thank you.
Uh-oh.